Bladder irritants are foods or drinks that can irritate the bladder, causing urinary frequency, urgency, or pelvic pain, or just kind of loss of bladder control. Some people try to limit their fluid intake to decrease the amount that they're urinating throughout the day, which that does work, but it can also cause your urine to be more concentrated, which will also irritate the bladder, causing an increase in urinary frequency, pain, and loss of bladder control. Some of the most common bladder irritants are things with a lot of caffeine, carbonation, artificial sweeteners. So some of those common ones that we see are things like your energy drink here, coffee, even some decaf coffees can irritate your bladder. Then we also have regular tea, and even green tea can also be a bladder irritant. And then here is my personal favorite, the Diet Coke. It has caffeine, carbonation, and artificial sweeteners. So sodas can really be very irritating to the bladder and cause those bladder issues. And then we also have things that are foods or drinks that are citrusy in nature, like your orange juices. So the best thing to do is always replace these things with your water. It's recommended to get 8 to 12 cups of fluid per day, and water is going to keep you really hydrated. It's not going to irritate your bladder. If you don't like straight up water, you can always add fruits that are non-citrus to your water, like cucumbers or pineapples. You can always dilute juices that are citrusy in nature. That's going to make it a little bit better. Or you can add maybe an herbal tea that doesn't have caffeine in it if you're a tea drinker. If you have bladder problems, urinary incontinence, frequency, or pelvic pain, then pelvic floor physical therapy may be helpful for you.